Okay, so hello everyone and a very warm welcome to a DAMS Pune student, Siddharth. Congratulations, Siddharth, on your excellent
Thank
performance
you, ma'am.
in 2021. And,
Thank you, ma'am.
and in fact, you should say the score yourself because, yes,
So I got a 670.
excellent.
Uh,
And you know that's an excellent, excellent score. And thank you so much for making us so proud. We are indeed really, really fortunate to have you join us today because the reason why we wanted to speak with you was because when your juniors hear from or your peers hear from someone, they sort of they can understand or they associate with the whatever you tell them today is going to be much more helpful than what I say. So that's mainly the
yes,
reason.
ma'am.
Right. So you are a pre-foundation 2017 student. So you've been with DAMS Pune for 4 years now. Tell me, how has this association of 4 years been with DAMS?
Ma'am, it's been great. I mean, I started off in my third year, and ever since that, it's been amazing. The association, the teachers are very good. And the weekends used to be slightly hectic, but they were completely worth it. I mean, giving the time for the dance classes. Uh, they were in-person classes, and all the teachers, I think, did justice to their subjects. So it was amazing.
So the general, sometimes when I get feedback from students or the ones who've not yet joined us, the first thing they tell us is that how is it possible to sit for 12 hours, 10 to 12 hours at a stretch? Did you think that was really a problem?
No, ma'am. I think there are enough of breaks in between.
Yeah.
And again, all of us used to go as a small group, my college friends and I.
Yeah.
So I think together it makes it much easier to sit for those 12 hours. I mean, anywhere in college, you're going to spend 12 hours with your friends. So
Yeah.
in a way, you're spending it more productively.
That
So
is true. That is true. And I always feel that the energy of a classroom is so much different from, let's say, an online class or
very true.
a
Very
recorded
true.
class, because the energy of a classroom is a completely different feel altogether. Uh,
Yes, ma'am.
yeah. Tell me, when did you really start preparing seriously for the exam?
Ma'am, so I attended all classes from the third year. That's the year with PSM and everything. The third minor, as they call it. So
Yes.
from my sixth term, I think it's easier to say sixth term. So from sixth term, I started attending, and by my ninth term, I had all my notes in place.
Very good.
So those notes actually helped a lot in my university exams, the MUHS exams also,
Yes.
because a lot of questions that come in the university exams are also to write a long question, say on chronic kidney disease. It's covered very well in the notes. So if you just replicate the notes there, I think you'll get a 7 out of 8 or an 8 out of 8 there, then and there.
Fantastic. Fantastic.
And then I started looking at NEET in my internship.
Yeah.
And again, the notes were a sort of backbone on which I could build on further. So that way for NEET PG, I started preparing in my internship. But it always helps if you have already made all the notes and have them in one place and have read them once.
Yes. So that's an important point that you've made, that by the time you actually went into your internship, by the time you're really thinking, by the time you started thinking of NEET PG seriously, but you already had all your notes in place. So that's an important point, that you had finished with your notes. Now, do you think it's easier to revise from notes as compared to any other resource material, notes which you've written yourself? Don't you think it's much more easier to revise and retain? That's another thing. Revise and retain from your own handwritten notes.
Definitely, ma'am. I mean, writing your own notes, it's sort of like when someone's teaching you, you're just using different modalities of learning. You're listening to the professor also, and you're writing it down also. And what helps even more is, I think, within, say, after the class, over the next 5 days, what we used to do is a group of friends, we used to sit and discuss those notes. So that way you're teaching it to someone and again, sort of revising it. So if you revise it immediately after the class, I think you retain it much better than, say, opening them a year later and saying that now I'm going to start preparing for NEET.
Yes.
So handwritten notes are much better. And secondly, the DAMS notes are very concise. So say in the last 2 months, you cannot open Harrison and say, I'm going to read all my medicine. So at that time, you have those concise notes, which precisely cover the important topics for the entrance. So it makes it very easy to revise and you don't get very stressed. If you open, say, a big book towards the end, then at least I would get definitely.
Yes, definitely. You've got all your Harrison or all your, let's say, Get On, for instance, is in a register, and which you've written yourself. And it's so easy to revise it again and again. And that sense of achievement, it's doable. That one register is doable, and then you do it again and again. And every time you get, your confidence increases a notch. So that is something we always lay stress on: multiple revisions. Could you do multiple revisions before your NEET PG?
Yes, ma'am. In fact, a lot of revisions, because in our case, the exam kept on getting cancelled. So it was
postponed, yes.
Lots of revisions. But I think those revisions ultimately help. And in an exam like NEET, it's more about perseverance than, you have to actually stick to it and keep on revising it again and again.
Yes.
And you should keep the basic component of the notes the same, but say you do an MCQ and you find an interesting point or a concept, then you can add it to the notes.
Absolutely. That's the point we always keep making. Anything new, anything extra that you've, during your preparation, whatever you find extra, just add it to your notes, so that just before the exam, you're not looking for, different resource materials. Everything is in one register. So that's a very interesting point, and that's a very important point that you've made. So revising and retaining that knowledge becomes easier from your own handwritten notes. Did you, there has been a change in the pattern over ever since you've been with DAMS. You've been hearing about the change in the Central Institute exam pattern, the NEET PG pattern, and this year there were 200 questions. Clinical, integrated, and apply. So how was your journey, over the last 3 to 4 years? How has it been? How did it help you tackle this new pattern? Did you get perturbed? Did you get rattled? Or was this a very seamless kind of a transition from the old to the new pattern?
So ma'am, I'd give 4 points. I'll give my answer in 4 points. Good. So the first is, when the exam pattern changed, there was a lot of panic that, earlier there are 300 questions and now there are 200. And in general, there is a lot of panic saying that this year, these many specialty seats have increased or decreased, or this state gets a bigger quota of seats than that state. So it makes a difference as to which state you're from, or for any other matter. But there are certain things which are in your control and there are certain things which are not in your control. So like in our exam, it went from 300 to 200 questions overnight. But then that changes the playing field for everyone. So only the things which are in your control, you should worry about them. The rest of it, it's not worth entertaining that idea also. So that is the first thing. The second thing I'd say, ma'am, is that it's equally important to attend clinics in your college. Like in AFMC, we had fantastic clinics and fantastic professors. So that sort of builds on your concepts. And it gives you an approach to things like, for example, in this exam, there were questions like, there's a patient with anemia who's not eating green leafy vegetables. So it's in the options, you had B12, iron, folate, but green leafy vegetables, so it's folate. So if you've actually sat in an OPD, it comes automatically. Yeah. So you should definitely attend clinics. And I'd say even DAMS is changing the sort of, in the GTs, as I was giving them over the years, the pattern of questions were changed to fit the current clinical pattern. So even that helped a lot.
Correct. So that was the next point which I was going to ask you, is how many GTs, how many CBTs or SWTs did you take? Were you serious about them?
So I think you should start, I had a plan that I would give 1 GT every 10 days from all platforms possible. Yes. Because in a GT, you're doing 300 questions in 3 hours. So that's, even if you revise the same GT, you're doing 300 topics in one go, say in one day, which is much more than you can cover by reading any notes or books. So I think I'd say 50% of your time give for notes, but the rest 50% give GTs and add those points back to your notes. Because I was quite lazy in the beginning to give GTs. I mean, a lot of my friends pushed me into it. That's why I started. But then the GTs are a much bigger force multiplier. I mean, the amount of topics you cover in 3 hours is enormous. And initially, the score in your GT won't be very good. At least it wasn't for me. But it's just, you shouldn't look at the score, rather you should just look at the percentile as it improves, and think of it as a learning experience, because that is by far the fastest way you can learn things.
Did you also follow our clinical rounds on the app, or anything extra that we brought in over the year, especially over the last year, 2020 and this year?
Not really, ma'am. I had a look at the AIIMS module, which I found very good.
Okay.
And the AIIMS module helped a lot in the INI-CT exam also.
Yeah. So your rest was basically concentrating on notes, revising, and the tests were also an extremely important part of your preparation. That is an extremely important part, isn't it? Because tests really tell you where you stand, right? One more point which I want to bring out is, I know Kunal from your college is also, not your college, from our college. The three of us share the same college. So he's also done exceedingly well. Were you?
So actually, ma'am, Kunal, I, and another of our batchmate, the three of us used to study together. So
why I'm asking you this is because I want to bring out another point, is this, a buddy system. That is that, you should interact with your friends and you should discuss with your friends. This is a point which I keep stressing again and again, that the more you discuss, the more it helps you to retain. So that's why I'm asking you this. Yeah, carry on.
So ma'am, like when I was doing my internships, it was a big change because I left AFMC to another college, and I was in between new people. I mean, I didn't have my usual friends, and and after that there were some problems. I lost my grandfather to COVID in my internship year. So there were days on which I couldn't get anything done, and we had a lot of COVID ICU duties. So it used to get very stressful, and on some days there was absolutely, I couldn't study for an hour or so. So about 3 or 4 months in, all three of us decided that we'll study together. So we used to pick up one topic or one grand test, and we used to sit and discuss that for 3 hours on the phone.
Wonderful. That's really good. So you did, even in this difficult period, you did manage to keep in touch with each other. In fact, I sincerely feel that this exam probably was the toughest because of the given situation. And like you said, there was a tragedy in your family, and the kind of duties and the kind of, the kind of environment that was there, which was extremely stressful. It was just adding to the stress that you were going.
In fact, the buddy system helps that way because you're not the only one going through it. Like the three of us have a similar, and then when you're with friends, you can deal with it with some humor or something. And secondly, everyone brings something to the table. So he might have read a different book, or he might go to a different platform. So they all sort of bring everything together.
Yes.
And I think discussing GTs you can do in small groups of 3 and 4.
Yes.
And because reviewing those 300 questions becomes a task in itself, and not a very, after you see your score, sometimes you're very disheartened. So in that case, it helps if you do it in groups.
Yes, good, great. Now tell me, what are your plans ahead? What subject are you interested in? What do you want to take up?
As of now, I think, ma'am, I'm confused between medicine and ophthalmology. So I'll decide.
Yeah, you've got a few days to decide. You have time to decide. So thank you so much, Siddharth.
Yes,
wish you all the best. And you must keep in touch. And thank you, like I said, for making us so proud. And heartiest congratulations to your parents as well, because parents are a very important support system in this entire journey. And thank you, and all the best, and God bless.
Yes, thank you. Thank you so much, ma'am.